Miss Johnson.
Hey, Dr. Kavorky, how are you doing?
I'm doing well. So, tell me what brings you in today.
I'm having some back pain. I was helping Zoe, my daughter, pack up some boxes
Okay.
about 2 days ago, and I've just been hurting ever since.
Zoe's your youngest, right?
She is my youngest. She's getting ready to move out, so
Oh,
be empty nesters.
Empty nest, huh?
Yeah.
That's a big life change. I can
Yeah.
understand why you'd be all stressed out. Let's see. So, let's hop up here. We'll take a look at you, okay?
Okay.
Let's see. So, where is the pain?
Sort of like right around my bra strap.
So, in the middle, between
Yeah.
your shoulders?
Yep.
Okay. Is this tender?
No.
Not really?
Mm-mm.
Okay. Let's see. Does this make it worse?
No.
How about the other way? How about if I pull this way?
No.
No? Okay. Let's test your strength. Put your arms up
Mm-hmm.
and push away. Okay, and pull the other way. Okay. And it's nothing's making it worse or anything?
No, pulling I could feel a little bit, but
Okay.
not bad.
Have you been taking anything?
I have been taking some ibuprofen. I know the bottle says that you're supposed to take one, but I've been taking like 3 at a time.
Oh, okay.
2 or 3 times a day.
2 or 3 times a day.
Yeah.
So
Just
600
trying to get rid of the
milligrams
pain.
2 or 3 times a day.
Yeah.
Well, ibuprofen can irritate your stomach lining, so that's not a good thing. That might be causing the stomach pain. I can give you something stronger. You might have tweaked a muscle back here, probably something pulled. I can give you something stronger and a muscle relaxer. That should help.
Okay.
You also said you haven't been sleeping very well, just not feeling so good.
Yeah.
I
don't
know
why.
you've been really stressed out. You should try to do something for yourself. When you're at home, we can do ice and heat, and then maybe try to go get a massage or some yoga, something for yourself. Okay?
Maybe after Zoe leaves, I can do that.
Yeah. Let's see. Let's see. I think we might prescribe you an anxiety drug too, just so you can sleep at night, because you know you haven't been sleeping. It's hard to have a good day if you can't get any sleep.
Okay.
And you're also overdue for your yearly physical. Let's
Yeah.
see. Can we set up an appointment once things calm down a little bit at home?
Yeah, I know. I've been putting that off. I know. So when I go up here, I will schedule it before I leave today.
Okay.
Okay.
Hey Mom, I'm home.
Hey, Zoe.
What are you doing up so late? It's the middle of the night.
I'm just not feeling good. I don't know what's going on.
What do you mean you're not feeling good?
I'm just still feeling nauseated and sick to my stomach. I'm just falling apart.
Didn't you go to the doctor to get something today?
I did. I went to the doctor, and she told me I was taking too much ibuprofen, so to stop taking that because that was probably irritating my stomach. She said I probably pulled a muscle when you and I were packing up those boxes. So she gave me some pain medicine and a muscle relaxer, which I've taken, but it really hadn't helped that much.
Well, I wonder why your stomach still hurts. I mean, you haven't even taken the ibuprofen if it was that.
Yeah.
I mean, you look bad. Do you need me to take you to the hospital?
No, I don't need to go to the hospital. I just want to, try to do what the doctor said, and I'll just stay on my heating pad. And she also gave me something to help me sleep, so I'm going to try to take that and see if I can go to bed.
Okay, be stubborn. Don't kill over like Granddaddy did.
I'm not being stubborn, Zoe.
Oh my God, Mom, what's wrong?
I'm all right.
Are you okay?
Yeah.
Okay, that's it. I'm calling 911.
All right, this is Miss Lydia Johnson, 48-year-old female. Her daughter called because she was complaining of chest pain. We did an ECG in the truck. She got a 20 gauge in her right AC. We've got oxygen at 3 right now. Here, I'll let you hook that up. We gave her 325 of aspirin, nitro times 2. She's still having chest pain, shortness of breath, diaphoretic. The last vital signs, we have 96% on 3 liters, BP 170 over 76, pulse 88, respiratory rate 26. Let's see, Anything else?
Anything, thank you. Is there anything else that we need to know?
Okay, she does have a 12-pack year history. This is her daughter Zoe. She's the one that called 911.
Okay. Hey, Miss Johnson, my name's Ashley. I'm going to be taking care of you today. I'm going to take a quick listen to your heart and lungs, okay?
Okay.
Okay, can you tell me what happened to bring you into the ER today?
I've just been having back pain and nausea.
Yeah, she helped me move the other day, and her back started to hurt, so she thought she just strained her back moving some boxes. But then her stomach was hurting too, so she did go to her primary care doctor.
Okay.
And she told them she was taking ibuprofen for the back pain, and they told her that could be what was making her stomach hurt. But then tonight she started having, like what she said was a toothache on top of it all, and like she wasn't sleeping,
Okay.
and obviously couldn't breathe.
Okay, well, what are you experiencing right now?
I just have a back pain and like pain right in here. It almost feels like I've got a bra on and it's like way too tight. It's just
Okay.
squeezing me.
Okay. Can you tell me, on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain ever, what your pain level would be?
I'd say about a 7 or 8.
Okay.
And they gave her a muscle relaxer and pain pills. Those are what they gave her at the doctor's office. So I just wanted
Okay.
you to have that.
Perfect. This will definitely be helpful. Okay. Miss Johnson, is there any family history of heart disease?
Oh my God, Mom, it's your heart.
It's not my heart.
We don't know that for certain. Emily here's going to be doing some lab draws, and that'll tell us more. But for right now, we don't know what's going on. Okay.
Well, my dad had a heart attack.
Okay.
So,
Not just your dad, but his dad. And then Uncle Mike had a heart attack, but thank God he didn't die.
Okay. Is there any other chronic health issues that you have going on right now?
well, it's been over a year since I had a physical, but I do take a blood pressure pill and I take Synthroid for
Okay.
my thyroid.
Okay.
When the doctor told you about your cholesterol too high, it's too high.
But I'm not on any medicine for my cholesterol. He didn't give me any medicine.
Okay. And the EMT said that you had a smoking history.
Yes, I do smoke, but I'm like down to 1 or 2 cigarettes a day. I've almost quit. Zoe, I've almost quit.
Okay. Emily here's going to stay with you while I go inform the doctor. Okay.
Hi, Miss Johnson. I'm Dr. Ross. After looking at your labs and your ECG, we have come to the conclusion that you did have a non-ST elevated MI. So we're going to admit you to a floor. You'll have constant cardiac monitoring. We're going to get you a cardiac cath procedure. We'll have that scheduled pretty soon. Let's see. Go ahead and keep the oxygen on. Nitro, morphine as needed. It's okay, Lydia. You're in good hands.
Dr. Ross, before you leave, she did say that she hasn't had a physical in over a year. Do you want to order a fasting lipid?
Yeah, I'll add that to the orders. Here's her chart.
Okay, perfect. Thank you. Miss Johnson, I know this is scary. Do you have any more questions?
Oh my God, Mom, you had a heart attack. I told you.
I just cannot believe that I had a heart attack. You know, I'm not old enough to have a heart attack, and I'm feeling better now, so I can't believe it.
Yes, your ECG did show that you did have a non-elevated STMI. What that does mean is that you did have a partial blockage in one of your coronary arteries. Good thing is, it was good that your daughter called 911 when she did, because it is a partial blockage, not a complete blockage, and you got here before it got any worse.
Well, I'm I'll do whatever y'all tell me to do, you know, if the doctor thinks I need to have this done.
How soon can we do it?
Well, the procedure, let me describe the procedure. A cardiac cath is going to be where they're going to insert a thin, small catheter in a large blood vessel that leads to your heart. Once in there, and depending on where the doctor wants to go, it's going to be either in your wrist or your groin area. Once in there, they'll inject the contrast dye, and it's going to show up on an x-ray the blood flow and where that blockage is. Good thing is, once they're in there, they'll be able to either fix the blockage or put stents in. And it's one incision, it's a routine procedure, and you should be discharged by tomorrow.
Okay, well, if that's what needs to be done, then let's do it.
And that will be done today?
Well, the doctor's going to be putting in orders. You're going to be transferred to a continuous monitoring floor. From there, you'll go to radiology, and then they'll do the procedure down there.
Okay.
Hi, Mrs. Johnson.
Hey.
Hi, Zoe. How you doing?
Good.
You get to
How
go
are you?
home today. That's exciting.
Excited.
I have your discharge instructions to go through with you, okay?
Okay.
So you have some medications you're going to be going home with that you probably haven't seen before. I'll go through those with you, all right?
So I'll have new medications
Yes.
other than the
Yeah.
ones I take?
Yep.
Okay.
So I'm going to go through those with you and make sure you are understanding what you need to do with those, okay? And it's
Okay.
good Zoe's here as well, so she hears what you need to understand about those. Okay, one of the drugs you're going home with is an ACE inhibitor. It's called lisinopril, okay? This is for management of your high blood pressure. If at any time while you're on this medication you develop a rash, facial swelling, lip swelling, tongue swelling, call your doctor immediately, okay?
Okay.
I don't expect that to happen, but just so you're aware, you want to make sure you call your doctor, all right? Another medication for your high blood pressure is a beta blocker. It's called metoprolol. That's also going to help manage your blood pressure. Something you are going to have to do with this drug is get used to taking your blood pressure on your own at home. Okay, now you can get an automatic blood pressure cuff machine at CVS, Walgreens, Rite Aid, and they're pretty simple to use. So what you want to do is take your blood pressure before that medication, the metoprolol, and if your heart rate, which will come up as well as your blood pressure, is below 60 beats per minute, don't take the medication and just hold off and wait till your next dose and then take it again and check it again, okay? What do you have next? A statin. Okay, so this is atorvastatin. This drug is to help with your cholesterol,
Okay.
because cholesterol can build up in your arteries and cause blockages and lead to heart attacks, and we want to avoid that, right? So, something else that you're going to need to do as far as cholesterol management is adhere to a cardiac diet. Do you have any idea what that means?
I don't.
Okay. Well, basically, it just means you're going to eat healthy. You're going to have some fresh fruits and veggies. You're going to do lean meats like chicken and fish. You want to avoid fried foods, fast foods, high sugar foods, you know, all the stuff we love.
Yeah.
That's good.
No more of that. So that's that on the cardiac. When you do fill these prescriptions, you're going to want to pick up aspirin, a bottle of aspirin, 81 milligram tablets. Take that daily. That is a platelet inhibitor, so it will prevent platelets from clumping in your blood, which can lead to clogging and or possible emboli that could lead to another blockage or heart attack. Okay. And another drug similar to that, which is a prescription, is called clopidogrel. And with these drugs, there's a couple things you have to remember as well. You want to avoid alcohol, and you also want to avoid taking NSAIDs, which would be ibuprofen, Aleve, as well as acetaminophen, which is your Tylenol, okay? Because the risk of adding those to the mix of these drugs is gastrointestinal bleeding. So while you're taking these medications, you also want to be aware of any abnormal bleeding, such as your gums starting to bleed, bruising, and also
keep an eye on if your stool starts to change color, if it becomes black and tarry, you want to call the doctor. So you just want to make sure you avoid all those things I talked about, the NSAIDs and the acetaminophen, because they will exacerbate that side effect. Okay. Also with the clopidogrel, you will have to have some periodic labs drawn at your primary health care provider just to check your platelet count. So when you do your follow-up with your primary care physician, which you should make an appointment with him within the next week, he can talk to you about when you should go have those labs drawn. Okay?
Okay.
Last prescription for you is your nicotine patches. That's going to help with the smoking. So it's basically like a sticker. You'll peel it off the backing and place it on a patch of skin that is clean and dry and free of lotion or oils. You're going to want to take it off at night when you go to sleep and put another patch on the next morning at the same time, alternate areas. So you may want to put it on like this shoulder one day and then the next day put it on the other shoulder.
Okay.
Okay. Very important, you do not smoke while you are wearing one of the patches.
Is it
Okay.
dangerous?
Yeah, so it's very important that you don't do that.
Did you hear that?
I heard. No smoking.
So, just want to make sure I go over with you, if you are home and you start to experience shortness of breath that's unrelieved with rest, chest pains, jaw pain, that tightness in your chest, the symptoms that you had this time, make sure you call right away. I know this time you kind of weren't sure if you should call or not, but it's better to call and have the help if you need it than to not call and not have the help.
Okay.
Okay. And I'm going to put all of this information into this folder for you. So you have it to peruse over, and then if you have any more questions, you can call us or you can ask your primary care doctor when you go see him.
Or I can just pick up, excuse me, those prescriptions at
Yes.
Rite Aid and the blood pressure cuff.
Yep. And if you want, here's some
Awesome.
prescriptions for you, and you can just take those right to CVS, and you can get those as well as the aspirin and the blood pressure, the automatic blood pressure cuff. Okay. So this is all for you. Do you have any other questions for me?
No, thank you for going over this. This is a lot of information.
It is.
Thanks.
it
I'm glad we
is.
have it in writing.
Yeah.
But
I'm
yeah,
really glad we have
and
it
I
in
hope
writing.
you are feeling better and don't see you soon.
I know. Still can't believe I had a heart attack at 48, but
Wow.
I'm gonna try to do all the right things so
Absolutely.
I
And
can
you've
see
got
my
to.
grandbabies.
Do you have a medicine for stubbornness?
I don't, unfortunately. All right,
Thanks
guys.
again.
You take care.
Thank you, you too.